Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, orthopedic specialist, and someone who teaches people all around the world with back, butt, and sciatica problems how to resolve their pain naturally. And the topic of this video is delayed pain doesn't make sense. All right, so every day I have people reach out to me and say, Dr. Charlie, I feel fine when I'm doing things, but the next day I hurt, or hours later I hurt. What's going on with that? How can you make sense of that? I know, Charlie, you're a physical therapist, so like what exercises are we going to do to target this? Because nothing really makes sense. How are you going to be able to help me? And so I just wanted to take a few moments today to share with you what that might mean, and kind of just how to look at it a little differently. Okay, so this way you're not so confused, and maybe there's some understanding you can have here. Okay, so if I look tired, it's because I am tired. I've been up since like midnight, and now it's like 4 o'clock. All right, meaning 12 a.m. Actually working on some content all the way until today. So I've been up for a long time. And you see this thing here? Right, there's a story behind this. All right, so I stepped on this in the middle of the night. You can see that point there. All right, so I stepped on it. It was dark. This bent over, and this point went right into the bottom of my foot. And because of that, I have this big blood blister on the bottom of my foot. My daughter didn't clean up her toys, right? And so, do you think that when I stepped on that little pointy plastic thing at 2:30 or whatever time it was, right, in the dark, do you think that hurt? The answer is yeah, that probably really hurt, right? And I have the physical proof to show that it hurt, right? I think I rolled up in a ball, dropped like a sack of potatoes, or like my mother-in-law, a sack of potatoes would say, right? And didn't want to put weight on my foot. I hobbled around for a few minutes, didn't want to wake up my wife because she was sleeping. I was okay, but it hurt. All right, I knew I'd get over it. All right, and I did. Right, I'm still here to shoot this video today, right? And so the reason I bring that little story up is because when something physical happens to your body, all right, you feel it immediately in the moment. All right, what's up, guys? Hey, man. There's no question about whether or not something happened. There's no question about, did I just step on something? Right? I didn't step on this thing, and then 12 hours later or 6 hours later, feel pain in my foot. In fact, now it actually feels better, right? And so the reason I say that is that if structural problems are driving your pain, if there's an issue within the tissues, if you bend over and you herniate a disc, you're going to feel it. Right? It might feel worse later. Right? You might not be able to move the next day, but you're going to notice in the moment. There's not going to be a question about, hey, gosh, I just can't recall what I did there. Right? I just can't recall any moment when I felt anything in my back. It just kind of like came on. I don't really remember it. Right? But this is what people do all the time. And this is what happens all the time. Delayed pain is very common. I'll explain to you what it means here in a moment. Lots of people I work with, they can't exactly identify the thing which has created their symptoms. It just came on. They're not really sure what happened. They don't remember a specific injury happening. But they always try to link it back to what we call a perceived injury. Almost always. So if you're in pain, are you doing that? Are you unsure about the cause of your pain, but you want to blame it on sitting too long, right, at a baseball game? I don't even know if it's baseball season. All right, maybe it's hockey season. Or the fact that you've been sitting for 20 years and finally it caught up for you, or it caught up to you, even though you've been sitting without pain for 19 years and 364 days. And now all of a sudden your back is bad. Are you blaming it on the fact that when you were growing up, you played football and you were an athlete, and that's why your back hurts today, right? Now look, I'm not saying that maybe it has nothing to do with anything, but if you're currently stuck in pain, you have some type of back, butt, or sciatica problem, again, this is my specialty, this is what I help people and coach people through, and you're like, man, my pain just won't go away, and I'm stuck in this kind of chronic pain cycle. Chronic pain would be defined as anything greater than 4, greater than 6 months, for sure. And man, I just can't I can't put my finger on what it was. Now that you're saying that whole perceived injury thing, Charlie, like, you're right. I don't actually know if that thing that I'm saying injured me or was the cause of my pain. I don't actually know if that's true. That's a perceived injury. All right? And so what does it mean if your symptoms are delayed? What does it mean if you're doing something? You're running, you're lifting, you're doing whatever you're blaming as the cause of your pain, right? You don't feel anything, but the next day you do. It's different than muscle soreness. You all know that if you do a bunch of push-ups or something like that, you're going to feel some soreness in your muscles. But what's the difference? First things first, again, just to be very clear, if you're experiencing delayed symptoms, that is not consistent, is highly inconsistent with a problem within your tissues. Structural problem. If you break a bone, you know it immediately. If you step on some toy or some plastic part, I don't even know what this is, right? You say ouch, you lay on the floor, you drop like a sack of potatoes, you hold your foot, and you've got living proof, blood blister, right? Blood blister that something happened. There's no question about it. I think you can agree. If you cut your finger, you don't question what happened there. You don't say, well, I just can't really remember. I got this huge cut on my hand. I just don't even know what happened there. All right? That would be weird. And so when things get weird, folks, they're generally wired. And so you have to understand that your mind can create very physical symptoms. This is why you have to find someone who understands the mind and the body. Right? The physiology of the body and the psychology of what is pain. Oftentimes, the thing which fuels pain is this questioning, this hypervigilance around the pain. The fear, the worry, the anxiety of, oh my gosh, the stakes are so high. I really would love to get back to working out. And I went for a workout today and I felt good, but maybe you were distracted while it happened. While you were distracted, you were authentically enrolled in the joy of doing that thing. It starved the pain of preoccupation. Pain is a great preoccupier. You remove the preoccupation, remove the focus on it. While I was doing all those things, stressing out all my joints and all my discs and my sciatic nerve and all this stuff, I didn't feel it. But later, it was really bad. Later, when you go home, when you're sitting there, when you start to ask questions like, wow, I had so much fun earlier, but you know what? Maybe I overdid it. Maybe I overcooked it. I hope I didn't do too much. I hope I didn't do too much. I wonder if that was good, or I wonder if that was bad. I wonder if I'm going to wake up tomorrow and be okay. When you start to ask those questions, who are you being as a person who would ask those questions? Are you cool, calm, collective, confident in your choice to have engaged in that exercise? Or are you questioning things? Are you somewhat fearful, worried? Are you being someone who's a little anxious, a little unsure, maybe a little confused about what's happening? And in that state, you start to raise the flags. You start to train your brain that that thing equals pain later on. And so guess what? Every time you do that activity, later on, here it comes. Yep, see? Self-fulfilling negative feedback loop. I shouldn't have done that. And then you beat yourself up. You become very self-critical. See, I can't do that thing. And before you know it, you used to be able to do all this stuff. And your ability to function gets less and less and less. And you avoid stuff. And the more you avoid things, because you're fearful or worried or concerned or whatever, for good reason, I get it, the more you reinforce that it's dangerous. And the more you perceive the danger of a given activity, the more pain it causes. And you just reinforce that over time. But here's the thing. You can start to break that loop. Because if you go from a place of ignorance, not knowing what delayed pain might mean. Now, in all fairness, delayed pain is just one sign that your mind might be driving your pain experience. But if you can go from a place of not knowing what delayed pain means to maybe watching a video like this and being like, wow, that kind of actually makes sense, to a place of knowing and having faith and understanding that maybe he's right. What if this isn't as physical as I thought? Weird, right? Coming from a physical therapist, but you've got to understand both sides of the coin. And so when you can come to that realization, by the way, we do this with people who work with us inside our private coaching program, the Glute Relief Accelerator program. We help them build a case for whether or not their pain is coming from the structure of their body or their brain. All right, structural or non-structural. And that's the diagnosis that really matters. And so this is one piece of evidence. And so maybe you're watching this and you're like, yeah, but, and I get it, that's okay. You can say yeah, buts. But the next time you step on something or you really injure yourself, you're not going to question it. You're going to feel it later probably, just like I do, right? But you're not going to question it. You're not going to place the blame on some perceived thing. I was fine during it, but I have pain after. Hey, we do recognize what that could mean, right? Yeah, but, I don't know. Can you prove it or can you not? And this is the challenge, right? So again, delayed symptoms, a sign that your mind might be driving the pain experience. Totally normal. Doesn't mean it's made up. Doesn't mean you're crazy. You're good. Very normal for people who have tried lots of different things and can't get the results that they're looking for. At least a component of it usually is that they need to shift their pain paradigm. They need to shift their understanding of what's happening. And at the end of the day, the thing that shifts belief the most and or shifts results the most, at least in my experience, is when you can start to educate people and bring them from a place of not knowing what this stuff means to a place of clarity and knowing. And you do that by building a case. Starting to challenge what you believe is happening. That is kind of weird, Charlie. You stepped on it, you're right. I stepped on one of those things too before. Actually, yesterday I did this thing, I stubbed my toe and it hurt in the moment. You're right. Every time I injure something, I feel pain in the moment. It doesn't take hours. It doesn't take the next day. What's up with that? And just that little wait a second. That's not really making sense. Maybe he's onto something. That starts to move you in the direction of understanding. And again, and there's faith in understanding, not blindly, but in education. This is why I'm so passionate about teaching people this stuff. All right? And so hopefully this was helpful. If you're experiencing delayed symptoms, you're not crazy. It's not weird. Doctors might say it makes no sense. Physical therapist, chiropractor, osteopath, all kinds of different people might not have any idea what it is and what it means. They might still be saying, well, that's because, I don't know, the sciatic nerve this or the disc that or whatever. I get it. That's fine. And again, it's just one piece. I don't know your complete case here, which is why we do what I call a case review with anybody who applies to work with us inside the private program, so that we can verify with 100% certainty we can absolutely help them, all right? But at the end of the day, start to challenge it, start to question it. That is, if you ask me, the most logical explanation for why delayed symptoms occur. It's not the structural theory. It's the non-structural theory. It's the fact that the mind, when all said and done, starts to ruminate on things, creates a little bit of dysregulation, a little bit of hypervigilance, a little bit of attention and focus. Where's my pain? Did I do that? Was I okay? Creates a little bit of dis-ease within the system. And before you know it, disease shows up in your butt, in your back, in your leg. All right, something to consider. Hopefully this was helpful. If you all are still unsure about what's going on, all right, again, I help people all around the world with back, butt, side, and problems. Be sure to check out and download my free DIY diagnostic guide. I go through the entire diagnostic algorithm for structural problems. I bent over, ouch, that hurts. And also some non-structural stuff. Scroll to the very bottom of the guide, you'll be able to see some things that will help kind of maybe convince you one way or the other. All right, again, this is Dr. Charlie. Thanks so much for checking out the channel. Appreciate it. Be sure to like and then comment below.